So influenza is very communicable. We typically see it starting in the winter. Right now we're seeing a significant amount of cases, still very active. It started mostly with influenza B in December, and now we're seeing an even mix of influenza A and B. In terms of the disease itself, it's, thankfully, typically a 7 to 10 day course of flu-like illness. Patients typically feel rather ill, cough, runny nose, body aches, chills, fevers. Most of the time the patients end up doing well after about 7 to 10 days. There is some significant mortality that we're seeing throughout the year, throughout the United States. But for the most part, it's self-limited and most patients improve on their own. The difference between the two is mostly based upon either the H or the N, the hemagglutinin or the neuraminidase, and there are different strains. There are many different strains, but influenza B is typically, for the most part, A and B are just as transmissible, and patients can get just as sick. There's not a whole lot of difference in terms of how patients are feeling. Usually we see influenza A early and then influenza B late. This year it's a little different. This year we're seeing B first and then A. So we are seeing some gastrointestinal symptoms this year with influenza, typically the influenza B, but typically when patients call something the stomach flu, it's actually more an enterovirus or a norovirus rather than influenza virus. So the best thing you could do to try and avoid the flu is to get vaccinated. But then going forward, hand washing can be very effective in preventing transmission of the flu. If you have an ill family member at home, you can wear a mask in the house. Wearing a mask in public is not necessarily recommended. And then if you are ill, being started on Tamiflu can decrease transmission to other people, especially in your home or in your place of work. So seeking medical attention, for the most part, if someone is persistently febrile, is getting short of breath, those are pretty much the major implications. If they're severely weak, unable to get out of bed, those are pretty reasonable indications to come to the hospital. Most of the time, patients come in with fever, body aches, chills, they can't get out of bed, they feel terrible, and they end up coming in for fluids. Best thing you can do to help take care of this on your own is to manage the fever with ibuprofen or acetaminophen, drink plenty of fluids, and stay home from work. One of the larger recommendations in terms of management would be to use Tamiflu or oseltamivir, that can really only be started within the first 2 days. It is very useful to start this medication on patients in sicker populations, like patients with underlying lung disease, young children less than 2 years old, or in any patients who are immunocompromised. That medication is most certainly indicated. And we're also using it for all pregnant patients as well. If given after the first 2 days, the effect is very minimal. And that medication does have some decreased effect in terms of your, or increased improvement in your symptoms by about 16 to 24 hours. The flu itself lasts about 7 to 10 days. You are contagious about 24 hours before you start showing symptoms. And typically once you start showing symptoms, you will be contagious for about 5 to 7 days. Children can be contagious for an extra week on top of that. But in terms of treatment, Tamiflu is something we can offer. It does have some GI side effects, and it's something that I counsel all my patients on, but it can decrease transmission.